Did you know that kidney disease can sneak up on you without any pain at all? No fever, no obvious symptoms, nothing that makes you think you need to rush to the doctor. In fact, a lot of my patients don't find out they have kidney disease until more than half of their kidney function is already gone. Today, I'm going to walk you through the earliest, most subtle, and most commonly missed signs that your kidneys might already be in trouble. Let's start with the first warning sign: frothy urine and swollen legs. If you've ever looked in the toilet and seen a thick layer of foam that just won't go away, don't ignore it. This often happens because an important protein in your blood, called albumin, is leaking into your urine. Albumin has a structure that's a bit like soap, which is why it creates all that foam when you pee. Now, try this simple test with me. Take your thumb and press it firmly into your shin for about 5 seconds. Now let go. If you see a dent left behind, that's called pitting edema. When you're losing that albumin protein in your urine, your blood can't hold onto fluid like it should. So, the fluid leaks out into your tissues, causing swelling, especially in your legs and even around your eyes. But here's where it gets dangerous. Even though your body looks swollen and full of fluid, your kidneys get confused and think you're dehydrated. So what do? They start holding onto more salt and water to compensate. This just makes the swelling even worse, trapping you in a vicious cycle. Next up, a really misunderstood sign: having to pee a lot at night. A lot of people think that urinating frequently is a sign of healthy, hard-working kidneys. Well, that's not always true. One of the very first abilities your kidneys lose when they are under stress is the ability to concentrate your urine, especially while you sleep. Normally, your kidneys work to make your urine more concentrated overnight so you don't have to wake up. But if you find yourself waking up multiple times every night to use the bathroom, a condition known as Nocturia, this could be one of the earliest signs of kidney trouble. Now, for our third clue, let's look at your hands. Take a close look at your fingernails. Normally, you see that little pale, half-moon shape at the base, right? That's called the lunula. But in some people with chronic kidney disease, something called half-and-half nails can develop. The bottom half of the nail, closer to your skin, looks pale or white, while the top half turns a reddish-brown color. Not everyone with kidney problems will get this, but when it does show up, it's a pretty strong clue that the kidneys might be struggling. Let's move on to number 4. The strange connection between phosphate, calcium, and what I call bone-hard arteries. Healthy kidneys have no problem filtering out extra phosphate that you get from your diet. But when your kidneys are damaged, they can't get rid of it properly. So, phosphate starts to build up in your blood. As the levels get too high, this phosphate starts grabbing onto calcium, forming tiny, hard crystals of calcium phosphate. These crystals can end up in some strange places. They can deposit in your skin, forming hard, painless lumps under the surface. Even more concerning, they can deposit inside your blood vessels, making them stiff and hard, almost like bone. In very severe cases, this can lead to a dangerous medical emergency called calciphylaxis, which can be life-threatening. This brings us to sign number 5: muscle cramps, bone loss, and even shrinking in height. Sign number 6 is something that can drive you crazy: itching, insomnia, and restless legs. When your kidneys aren't filtering your blood properly, waste products and toxins build up. This state is called uremia. One of the earliest and most annoying symptoms of uremia is an intense, unexplained itching that seems to come from deep within your skin. It's often worse at night and can make it impossible to sleep. On top of that, many patients develop restless leg syndrome. It's this overwhelming, irresistible urge to move your legs, especially when you're lying down trying to relax. This is thought to be linked to the chronic inflammation and disrupted iron metabolism that often come with kidney disease. Now for number 7, a metallic taste, bad breath, and a loss of appetite. A classic symptom of advancing kidney disease is a persistent metallic taste in your mouth, kind of like you're licking a coin. This happens because urea, a waste product in your blood, gets into your saliva. Bacteria in your mouth then break down this urea into ammonia, which causes something called uremic breath, a distinct smell that's often described as smelling like urine or ammonia. As you can imagine, having a metallic taste and bad breath all the time really affects your appetite. This often leads to nausea, not wanting to eat, and unintentional weight loss. Okay, sign number 8, easy bruising, anemia, and feeling totally exhausted. Those same uremic toxins we've been talking about can also mess with your platelets, the tiny cells that help your blood clot. When your platelets aren't working right, you might notice that you bruise very easily, get frequent nosebleeds, or your gums bleed when you brush your teeth. At the same time, your damaged kidneys start to fail at one of their other important jobs. Producing a hormone called erythropoietin, or EPO, is the signal that tells your bone marrow to make new red blood cells. When EPO levels drop, you don't make enough red blood cells, leading to anemia. This is why so many people with kidney disease feel profoundly tired. It's a bone-deep exhaustion, where even simple activities like walking up a flight of stairs can feel like climbing a mountain. And now, for the 9th and most dangerous sign of all, having no symptoms whatsoever. This is the most frightening part about kidney disease. Many people feel completely fine, completely normal, until their kidney function has already declined to stage 3 or even stage 4. For a huge number of people, the only way early-stage kidney disease is caught is through routine blood or urine tests ordered for a completely different reason. So, let's wrap this up. The most common causes of chronic kidney disease are diabetes and high blood pressure. But we're also seeing a rise in cases linked to the overuse of common pain medications like ibuprofen and naproxen. If you recognize yourself in any of the signs we've discussed today, please don't panic, but also don't ignore them. A simple blood and urine test is all it takes to check your kidney health. Getting tested today could protect your kidneys for decades to come. If you found this video helpful, please give it a like, subscribe for more health tips, and share it with someone you care about. This information could quietly save someone's kidneys, and that person might even be you. Thanks for watching.